Hello, my name is Dr. Robert Arnone. I'm an upper cervical specific doctor, also known as the brainstem doctor. Here to talk with you today about migraine headaches. And one thing I want to say is I've been through it before. I've had horrible headaches for years, and it is no fun at all. And I can completely relate. And I can relate to taking the pills, going in the, shutting the lights, shutting the music, laying down, trying different things, ice, avoiding certain foods, trying to even eat certain foods, watching out for caffeine, all these different things that maybe I tried. I'm sure a lot of you have tried as well. And some things you may find will help. And you may find some certain medications help, or making sure you drink enough water, or getting enough nutrition, and different things that you may find help you. Great. This video is for people who are looking for a better way. Something that makes sense, something that is corrective in nature, something that will allow improvement along the lines as we go further. Okay, so what am I talking about? Well, I'm talking about looking at the area that supplies the brain. It only makes sense. You see, people think that migraines are vascular in nature, and to some degree they're right. But that's not the sole cause. It's actually a neurovascular cause. So it's nervous system, nerves, as well as vessels, arteries, veins, capillaries, blood flow, as well as nerve flow. Okay, and what happens is it's at the base of the skull. So here's the model, back of the head and upper neck. This is called the upper cervical spine. Notice there's an opening in the base of your skull. We know that the brain is up in the head, and that's the central computer, and that's typically where the pain usually is, somewhere in the head, usually on one side, in some cases both sides, and sometimes we see these occipital type pains, right? Well, here's the thing. We know that there's nerves that come up into the head as well as vessels, but also through this opening, if it's lined up properly, is the lower brainstem and the spinal cord. The lower brainstem feeds the brain, must have continual transmission for the brain to work properly. If you notice here along the side of these vertebrae, we have this elastic piece. That's a vertebral artery. That's blood flow up to the head and brain. And so what happens is, from birth, from pulling on the head and neck to get the child out, we get misalignment at the upper neck. Or from falls as a child, or as we start to grow up, different falls off a bike, a skateboard, sports injuries. Then we get even older, and maybe there's more things like car accidents and such, and slips on the ice in the winter, and so many different injuries that occur. But what happens is this thing gets in the wrong position, and now it puts pressure on that brainstem, squeezing, tightening on that brainstem. Does not let the impulses get up to the brain properly. We also have an alteration in blood flow from the vertebral artery here. How on earth could the brain function correctly, or the head have the right feeling and be at ease, if we're choking off impulses to the brain, if we're increasing and decreasing alternately blood flow and nerve flow to the head? Sometimes it's too fast, too much, sometimes it's too slow. But it's not an even keel. It's not homeostasis, balance, at ease. It's not that at all. And I think you can relate to this if you're a migraine sufferer. So our method is not, let's take some pills and cover up. Let's just try to forget all these problems and pains that we're having. That does not correct the cause of the problem. We look at it as, let's find the problem. Let's analyze it, let's test it, let's prove it, let's show it to you, let's correct it and fix it. Now we've got something tangible that gets the job done, allows better blood flow and nerve flow, and allows you the best chance to improve without taking drugs, which not only cover it up, but there's dangerous side effects to that. What kind of life are you going to have in 5 years, 10 years? Are you even going to be alive or around if you keep going the way you're going? Something needs to be done, and if you realize that and you'd like some answers, reach out to me. You can comment in the box associated with this video. You can call me. Let's talk. Let's see if we can help you. There is a better way. Hang in there. Until then, take care.